So it really is our honor. We are part of this community. It's where we live, work, and play. And so we're so pleased to be a part of the organization with this donation and happy to see this program continue. Thank you.
Thank you.
Thank you so much for coming in today and for your support and generosity towards the social prescription program. Social prescribing is a holistic approach to healthcare that brings together the social and medical models of health and wellness. It provides a formal pathway for health providers to address the diverse components of health using the familiar and trusted process of writing a prescription. The goal of social prescription is twofold. It's to increase one's well-being with focus on the holistic self, and it creates a system shift by directing people away from expensive and overutilized medical services such as hospital visits, acute care, and community support for non-clinical issues. This initiative first began in the UK more than a decade ago, and they saw much success over the years, especially the last few years when loneliness, isolation, and depression have been at an all-time high due to the pandemic. Canada decided to adopt the UK's model of social prescribing, starting with a program for our older adult communities. Under the guidance and support of the OACAO, Older Adult Centres Association of Ontario, many senior active living centres have eagerly decided to participate in this project. We've partnered with healthcare professionals in our area to implement the project with the shared goal of benefiting the patient. LAF After 50 is the referral destination in Windsor. We have been growing this project here for a few years, with the first referrals coming in early 2021. At the present time, we have received over 270 referrals from over 45 referral sources. We complete intake and check-in processes in order to collect data for this rather new addition to formal healthcare, with the hopes of growing and sustaining it. We also do our best to create fair opportunities for all and are fortunate enough to be able to offer coverage for a membership fee to those who come to us through the social prescription route, removing a potential financial burden, which has been the most common barrier to participation. I'm so excited to be a part of a program like this. I firmly believe in the idea of combining the modern medical approach we know and use today with a more well-rounded approach that looks at not just the physical ailments, treatment, and care of a person, but the mental, emotional, and spiritual components as well. By committing to their social prescription, I have witnessed members' quality of life drastically improve in many ways through gaining friendships, learning a new skill, improving their mobility in a fitness class, decreased feelings of loneliness and isolation, contributing to the center through volunteer work, and finding purpose in life once again. To confirm and strengthen this belief, I've had the honor of witnessing many success stories from socially prescribed members over the last couple years. Two of those members are here with us today, Barb and George. We are extremely grateful that they are willing to share their story with us and how Life After 50 and social prescription has impacted their lives in a positive way.
City Center Healthcare. And I have a nurse practitioner there who suggested that I come to Life After 50, and she wrote my social prescription for me. Because at that point in time, I was in a new residence to me. My husband and I was housebound. I use a walker, I use all kinds of medical assistance, and so when she wrote it for me, I thought, okay, I'll try it. And then I went back and I told her, wow, thank you so much for giving me that social prescription, because it's really, really allowed me to become whole again. I've made friends, I've been able to do activities, I've been able to donate things through the crafts and knitting and crocheting programs, so I've become an active part of the community again. Not just someone sitting at home lonely and not knowing what to do. Because when you're lonely and you don't know what to do, you don't do the things you can. You don't pick up your needles, you don't pick up your yarn, you don't read your book. Because loneliness is an isolation unto itself. It really does affect the way your energy level works. You have no energy to do things. You really don't want to get up in the morning. You don't want to go for a walk. Doctor says, go for a walk, make you feel better. Well, gee, it would work if I could get my shoes on and get out the door. So being able to have a destination with a purpose has really helped me. And I know just about the names of everybody in this room. I couldn't have said that before I came here. the number of friends I had was 0. And so I am really fortunate not only to have this program, but to have medical community recognize this program's available, and for them to take the senior budget. I say I'm on a senior budget. That means government money only, which would have meant I couldn't have managed this. So with this social prescription, that barrier, that blockage was taken out of the way. And so all I had to do was participate. And I am so thankful.
I only moved to Windsor during the beginning of the pandemic. And, like her, there was a feeling of isolation and, just a disconnect from this community because I'm not from around here. And, my nurse practitioner suggested that I join this program. I am, I'm a social being. I'm kind of introverted yet extroverted. I'm a social being, but not. So it's very easy to get stuck in your apartment in those mundane things that you do, to get through the day. And some of them can be counterproductive, and some of them can be detrimental to your health. I mean, I really got to the point where, I was thinking, what's the point here? Mundane life is not so fun. But once being introduced to you great people at Life After 50 and all the programs here and the staff here, I have a renewed sense of vitality. The fitness programs, the social interactions. I talk to people that give me a history of how, the community of Windsor, evolved throughout the years. And for a person that just came here, you start to feel a connection. And, in addition to that, over time, my blood work was, first of all, was not doing so well when I came here. Results are through the roof now. I have the blood work of a person much younger than myself now. Thank God. Believe it or not, I am certainly convinced that you contributed to that. There were certain medications that I was taking, before I started Life After 50. And again, the associations, just the feeling of belonging, a place to go, a place to get up, get out of bed, to go to, see wonderful people. If you're not feeling very well, there's always somebody here that's got a story to tell with all your great life experiences. Just a wonderful place to be. I am so thrilled that I got into this program, and I just wish I could tell the world, tell the entire province. If you're an older person, this may not be the way for everybody, but I guarantee you it's the way for a lot of people. So thank you all very much. I look forward to many, many more years of coming to Life After 50, and this is my home now.
Would they have been able to receive the gains that they have had they waited another 5 more years? So my plea to everyone in my path is that we can't wait when it comes to socialization. We can't wait when it comes to interaction with people. We can't wait when it comes to taking our health and wellness seriously. So with that, this is what social prescription is. Thank you again, Caesars Windsor, for supporting our social prescription project. It means the world to us. As you can see, it means the world to our members. So thank you all today.
Thank you.